So.
Hi, my name's Stephen Faux. I'm a professor of rehabilitation medicine and pain medicine at St Vincent's. And I've spent a long time being interested in rural health and how people in the city can actually help people in the country get the health that they need. But it's through telehealth in the bush that I was able to be effective for one of the first times. I thought I'd tell you about a handful of cases I worked with telehealth in the bush. So I was contacted by telehealth in the bush to speak to a woman who'd fallen off her horse, hurt her knee and had a lot of trouble walking after that. I saw her on telehealth, and telehealth in the bush organised some physiotherapy, and I was able to send the local chemist a script for her to start some exercise. 6 weeks later, when things were not that much better, telehealth in the bush helped me organise an MRI of her knee, which we did in the local area. And when that came back, it became clear that she needed to have an operation to repair a damaged cartilage. And telehealth in the bush organised an outpatient referral for her, and then she had the surgery within a few weeks. And that was all completely on Medicare and cost her nothing out of pocket. I also helped speak to a woman who had significant pain and also stress associated with some financial difficulties to do with her cattle. It was interesting seeing her because she couldn't speak to me unless she was in her cattle shed standing on a stool to get the reception. But we were able to make it work, and I was able to send her some psychological information and some advice from a psychologist, and she was able to manage her pain using mental processes and psychological treatments. I also had a woman who was referred to me with pain. But I discovered that she had a thyroid problem, and that also her weight was swinging wildly. So telehealth in the bush helped me find an endocrinologist who got onto her and put her on the right medication for her thyroid. Her weight started not to shift as much, and we got a physiotherapist to see her online. That was through telehealth in the bush, and she did exceptionally well and was very happy with a very good outcome. And I also spoke to a chap with pain who was working in a retail industry in the Northern Territory. He needed an MRI, and that's not easy to get in rural centres. But telehealth in the bush sorted it, helped me find a place, and he had an MRI, and I was able to reassure him that he could just have physio and manage it with some non-opiate or non-morphine painkillers. Telehealth in the bush actually helps me to actually treat patients. I can diagnose them and I know what the treatment is, but I have no knowledge of the local resources. And that's where telehealth in the bush comes in. They help me find what local services I can get. They provide telehealth services for specialists that person needs so that I can continue to assess them. And I've been thoroughly impressed with the way they've been able to help me provide services to people in very remote parts of the country. So I hope other practitioners have the same sort of experience, and I'm really happy to keep working that way with telehealth in the bush. Thanks a lot.